Well, Chairman Smith has sworn us to secrecy, but I will tell you that we've been making definite progress really over the last 3 or 4 weeks, if not several months, on trying to get a solid package. Obviously, SALT is very concerning to some of the members, where you have California and New York, which have insane taxes on their citizens. We're trying to put to something into a package that will help alleviate some of the tax burden that they have. That said, Kelly, the bottom line is we have to worry about our debt. And as the Secretary said, our debt to GDP ratio really right now is killing us. So when we bring all these discussions together, we have to worry about one singular thing. It is the singular focus on our debt. And we're trying to have pro-growth tax policies to grow that GDP, to make sure that it is higher than our debt ratio. And so we try to grow ourselves really into a place of stability.
Well, Congressman, I understand the chairman may not want you to reveal too many details, but he in fact spoke with my colleague Julie Fine yesterday and suggested that when it comes to SALT particularly, everyone is going to end up unhappy with whatever compromise is made. With the way things are tracking now in conversation, do you expect there will be more unhappiness from some of those blue state SALT caucus members, or those who don't think the SALT cap should be materially lifted?
Well, I think it is a tension. It is a battle. We're worrying about our deficit, but those members in California, New York, the high tax states really do want some relief. Yeah, everybody's probably going to be proportionally unhappy as we move forward with this, but that's what would happen with all the tax packages. There are going to be some winners and some losers, but they're all going to be winners and losers in some regard.
And Congressman, as you were just alluding to the Treasury Secretary's testimony around the debt to GDP ratio, specifically, which he said is something that even the former Treasury Secretary Janet Yellen watched, rather than the sheer level of the deficit. When he was pushed under questioning if that deficit number itself was likely to go higher, he did say yes. And I wonder if that is an acceptable outcome to you as a Republican.
Well, we want the bottom line is we want the American economy to be able to, the American government to be able to repay its debts. That's the bottom line. It really doesn't matter specifically on numbers. The real crux of the matter is, can we pay back our debts? And if we're growing our economy greater than we're producing a deficit, that is the goal. That is the goal itself. So real numbers themselves are great, but you really look at ratios as to really what the most important factor is.
Well, and of course, spending has to factor into this as well, specifically where spending cuts have been identified or will be identified. And Congressman, I don't have to tell you, as we just heard from my colleague Tyler, Medicaid is very much in question in this argument. This is something that the Senate Minority Leader Chuck Schumer of New York spoke to us about here on Bloomberg yesterday. And this is what he said about Medicaid cuts in particular.
We asked them, give us specific examples of waste when they're cutting Medicaid. And they fail to come up with them or have one anecdotal thing that can't even be proven. We know that they want to slash Medicaid, not because of waste, but for one reason, and that is to give tax breaks to the wealthiest people in this country. God bless the people who made a lot of money, but they don't need a tax break, certainly when you're cutting Medicaid, which is going to cause huge layoffs, decline in health care, and closure of hospitals and nursing homes.
And of course, sir, you are not just a sitting congressman, you are also a medical doctor. And it's with that in mind that I ask you about this, considering we got new figures from the Congressional Budget Office in response to a question asked by Democrats about some of the various proposals that could be put forward here. The CBO estimated that capping federal spending in states that have expanded Medicaid, which hasn't been ruled out by the Speaker, would lead to 3.3 million people being booted off their coverage. Is that something you would support?
Well, first of all, Chuck Schumer's being false. He's being absolutely wrong in what he's stating. I'm a practicing physician. I can give you many examples of waste and fraud that's going on in the Medicaid system, so he doesn't know what he's talking about. Second of all, Republicans are destined, and this is what our plan is, still to raise Medicaid probably by about close to 25% over the next decade. We have to get to a system, and if you're going to pick one word for this administration, it's called accountability. And any business person, anybody who's looking at this program understands you can't run a business and you can't run a government without accountability. This Medicaid system has been a system that has been abused, used, fixed, and taken advantage of in so many different quarters. And it is okay, it is absolutely the right thing to do to look at this system and make sure that it works for the the people that is intended to work for, those who are eligible for Medicaid. So Chuck Schumer, shouting out those nonsense lies is really not helping the situation. Good Lord, I've been a physician for 35 years and I've taken care of really the most desperate of individuals. The last thing I want to do is not take care of individuals, but we have to be able to pay for it at the end of the day.
Well, and so to kind of come back to my original question, Congressman, if there are indeed millions of people who are booted from Medicaid rolls as a result of this legislation, is that an acceptable outcome?
So if you look at what's happened with the expansion population, we had people that left being insured by companies to go be insured by the federal government. If it means getting them back on insurance by companies and getting them off the federal dole, that's not losing health care, that's taking it off the federal books. But as far as people being kicked off health care, et cetera, those are scare tactics. We're literally trying to save a program for those who are eligible for it while trying to take the benefits truly who don't deserve them.